from a physiological standpoint, Dr. Gandhi, how does estrogen, again, we're going to hear this word over and over today, how does estrogen loss affect the hair growth cycle? And what players like DHT or thyroid function are you looking out for with your midlife patients?
Absolutely. Such a great question because over 50% of women do notice some type of hair loss and thinning, over this transition. So it's really impactful and it's really important that we talk about it. So what's happening is with, this declining estrogen levels, right? Remember, every single cell is feeling this in our body. So of course, our scalp, our hair as well, we notice that there's this relative sort of increase in androgens, right? And so, one example of an androgen is it's testosterone, for example, right? And so that relative imbalance. So it's not necessarily that the testosterone's going up or the androgens are going up. It's just that you have less of estrogen. And so what that ends up causing is that when you have more of that relatively, you can actually get more conversion of that to DHT, what you mentioned. And there's some people genetically that are even more predisposed to that happening. And then it's the DHT that ends up causing what we call the miniaturization of hair follicles. It actually affects the phase of hair growth. So there's different phases in a hair follicle's growth cycle. And so the growth phase unfortunately gets shortened, and then the resting phase gets lengthened. We end up noticing less growth, more shedding, and then the follicles that are affected actually produce less and finer hair. So this is why sometimes people are like, hey, I notice my hair is like more brittle, it's more dry.